Robin's in another room at the moment, but usually if we see his neurologist or his neuropsych or his GP or whatever, we are in the room together. And it's a real matter of tact, wondering, you know, how much one can say. And quite often I'll allow him to offer his interpretation of events and offer a bit of correction if it's important. But I often don't say what I might if I were talking to that person alone. And it's a bit of a problem because he's perfectly well aware of what's being said. And I wouldn't want to demoralise him further.
I think it's really important that you make provision to have your say, and even if it means making a separate appointment and just say, or writing a letter before you go, which can sometimes be a little bit awkward and confronting because what you want to say doesn't necessarily come up at the time. Quite a few of my research participants talked about the fact that in a doctor's consulting session, their spouse was really sort of sitting up straight and with it and having the conversation, patient to doctor relationship, and anything that they were saying or their rolled eyes or, you know, shakes of the head in the background were ignored. And they found that very isolating.
Yeah, certainly with the excellent neurologist and neuropsych, who are both friends and colleagues, that situation hasn't arisen. But I've sometimes thought I might present the situation slightly differently if you were not in the room. And I have spoken by phone to each of them and emailed if there's been a problem with medication. So it's probably okay, but I think you never quite know how distressing it may be to the person with Lewy body dementia. And because Alzheimer's patients are so out of it and people must talk about them and across them and so on all the time.
We would like to think that they didn't, obviously, but we know that it does happen.
It does happen.
And, you know, early in the stages of Alzheimer's disease, people can understand and have insight into those situations as well. And that's why we always recommend that you make a separate appointment or, you know, quite often I've seen situations where the consulting doctor will actually ask the person to leave the room and have a chat to each individual independently. And if that's part of their practice and it's not seen as you wanting to talk behind their back, that then is quite reassuring that you can have your own say. But I think that if that's not the norm, then it's perhaps easier to make a separate appointment. And just sort of say, you know, I've come here. And I think it's also important to recognise the fact that you have your own concerns.
I think these days we're just much more open about it.
It is confronting.
Oh, of course.